Bulimia nervosa is an eating disorder characterized by binge eating, which is eating a large amount of food in a short period of time, and experiencing a lack of control over eating, like they can't stop or contemplate what they're doing. This binge eating is followed by an inappropriate compensation called purging, by self-induced vomiting, taking laxatives, using diuretics, and enemas. Someone with bulimia might also fast or exercise excessively. Based on this, we can classify the types of bulimia as the purging type and the non-purging type. Both binge eating and inappropriate compensatory behaviors need to happen at least once a week for 3 months to make the diagnosis of bulimia. The severity of bulimia nervosa depends on the frequency of the inappropriate compensatory behaviors. A mild case has between 1 to 3 cases of inappropriate compensation per week. A moderate case averages 4 to 7 cases per week. A severe case averages somewhere between 8 to 13, and an extreme case is more than 14 cases of inappropriate compensatory behaviors per week. Bulimia nervosa is a cycle of binging and purging. Repeated self-induced vomiting leads to the erosion of dental enamel and calluses form on the back of the hands, known as Russell's sign. The parotid gland, one of the salivary glands, swells, and if you're wondering why, it's because vomiting causes the salivary gland to produce more and more saliva, which overstimulates the parotid glands and causes it to swell. According to a study published in 2020, individuals with bulimia or binge eating are at higher risk of developing type 2 diabetes mellitus. Purging via vomiting, diuretics, and enemas leads to dehydration, causing the depletion of electrolytes such as sodium, magnesium, and potassium, as well as a metabolic alkalosis. Hypokalemia, low potassium, can lead to muscle weakness, cardiac arrhythmias, and eventually to death. Standard treatment for bulimia nervosa uses a combination of nutritional counseling, psychotherapy, and pharmacotherapy. The nutritional counseling starts with 3 meals a day with 2 snacks. This way, the urge to binge and purge hopefully diminishes. CBT, cognitive behavioral therapy, helps in exploring why certain feelings and behaviors trigger the binge eating purging cycles. CBT is conducted over a 6-month period with an average of 20 sessions. CBT helps in establishing a regular pattern of eating and preventing relapse in the future. Unfortunately, someone with bulimia might relapse within the first 4 months of starting treatment. Regarding pharmacotherapy, the first-line treatment is the selective serotonin reuptake inhibitor fluoxetine. Those who do not tolerate or respond to fluoxetine may take a different selective serotonin reuptake inhibitor. Finally, although tricyclic antidepressants have a lot of side effects, TCAs are able to reduce binge eating and purging. Treatment with bupropion is contraindicated due to the increased risk of seizures. Indications for hospitalization include metabolic acidosis, cardiac arrhythmias, pancreatitis, suicidality, and cardiomyopathy. Now let's take a look at a clinical vignette. A 26-year-old woman is hospitalized for dehydration caused by severe laxative-induced diarrhea. She admits that she uses laxatives because she has been binge eating frequently and reports lack of control over her body once she starts eating. Which of the following medications would be the most appropriate to initiate? We have option A, valproic acid, option B, bupropion, option C, fluoxetine, and option D, lithium. We learned that the first-line therapy for bulimia nervosa is an SSRI, so the answer is fluoxetine. If the question was which of the following medication would be contraindicated, the answer would be bupropion because it lowers the seizure threshold in people with eating disorders. One thing before I let you go, although binge eating disorder is listed as a separate diagnosis in the DSM-5, it is very similar to bulimia. The only difference is that people with binge eating disorder don't go through inappropriate compensatory behaviors like self-induced vomiting. If this video helped you out, help me out and hit that subscribe button. And because you made it to this point of the video, here's a bonus mnemonic to remember the DSM-5 criteria for diagnosing bulimia. Binge, lack, purge, repeat. Binge for the recurrent episodes of binge eating, lack for the lack of self-control, purge for inappropriate compensatory behaviors like vomiting, diuretics, enemas, exercising, and fasting, and repeat for once a week for 3 months. If this video helped you out, help me out and hit that subscribe button. And if you want to see more videos like this one, click the like button. And until next time, stay wholesome. If you're still listening to this, comment down below, still here, and check out the eating disorders playlist for more videos like this one, and I'll see you in the next one.